Welcome to FSCDR Warriors Within. We are here to educate and bring awareness to sickle cell anemia. We partner with the Foundation of Sickle Cell Research and Disease to make more resources and accessibility to sickle cell anemia patients and warriors throughout to let them know that they have resources, connections, and abundance of love. So right now I have a special guest. Her name is Renee. How are you, Mama?
Hi guys, nice to meet you.
Nice to meet you too. How are you feeling?
I feel good. I feel very, very good today. It's been a blessed week, so why not?
All right.
How
And
about you?
I'm good. Thank you for asking.
Very
Thank you for
welcome.
joining.
Thank you. I really appreciate you guys inviting me to be here. So
So I
thanks.
want to just make you comfortable with this podcast. Like I said, we make awareness about sickle cell anemia. We interview different warriors so then that way they can tell their story. And we like to know your input, your output about your life because everybody's life is different. Everybody's trials and tribulations are different. And then hopefully we want to know your outlook on what you think the better outcome of sickle cell could have with new researches, new diseases, well, not new diseases, new things to help treat this disease. So let's just dive into it.
Okay.
We talked a little bit and we already caught up a little bit. So you told me you were 26 with a baby. Elaborate. I want you to elaborate to me about how hard was your pregnancy?
Honestly, so when I first found out I was pregnant with my son, things were going great. Honestly, I was excited. I always told myself, being that I always knew I had sickle cell, and that's one of the complications that you're told about when you're young. That having kids, you're not always going to be easy path. So I told myself I want to have my first child before I'm 25. That was always one of my goals. I was like, I have to because I want to be able to make sure I'm healthy enough to go through the experience. So the first couple months of having my son, regular pregnancy, you have, sorry, you have the nausea, the
The
crazy, yes,
sicknesses.
the sickness.
Yes.
Lord, morning sickness really had me
I,
when I first got pregnant.
I
I will
know.
say that. But everything was good with my sickness. I usually would go to my regular infusion appointments, so it really helped a lot. And I was working at the time. So when I got into my second trimester, I would say that's when things started to get a little bit more, hey, I need to slow things down. I ended up with COVID when I was 4 months pregnant, and it drove me right into a crisis. I was in the hospital for a whole month, and that's it. I don't know. It was just like really crazy to me because I was battling COVID, and I'm just like worried about my child. I
Yeah.
was like, I don't want, God forbid, to have a miscarriage because my body can't handle going through crises and COVID
Yeah.
at the same time. I When I got out the hospital from then, I went back to work, and it was not gonna say it was a very easy time to be pregnant and battling sickle cell and battling crises, also working. I ended up getting sick not even like a week later after returning to work. So I had to make the decision to stay at home and relax myself because the only thing that mattered to me is bringing my child here safely. I'm like, I'm already pregnant. I'm already been through all this craziness
Yeah.
and I'm like, that stress is not good for the baby.
No.
And I don't know. It just really scared me. It
So,
really, really
because
did.
I asked that because obviously, my pregnancy was probably totally different from
Yeah.
yours. I only have a sickle cell trait.
Mm-hmm.
So, of course, I always tell people we kind of experience same thing as you guys, but not really. Morning sickness definitely got me, but never to that extent. I always ask questions about like women. We don't understand how hard it is to have a baby when you have sickle cell. We don't understand how hard it is to go through your menstrual cycle when you have sickle cell. We don't talk about going through menopause when you have sickle cell. Those are little factors that women, like, honestly, I didn't think about that until like a long time ago. And I was like, oh my God. I'm like, this is stuff that they really have to really digest and do things differently. So how did your support work out for you when you got sick, like after like having your baby? Because I know that had to be hard. You got to bounce back and then you got a baby to look after and then God forbid you sick and you trying to pull together on that end. How did you pull together? How was your support with that?
Mm. Sorry, it was just
No, it's fine. Girl, take it all in. Like I said, transparency
um
moment.
Realistically, I had a good support system. I was engaged at the time when I was pregnant with my son. So my son's father, when I decided to make this, when we had to make the decision for me to start staying home for the sake of my pregnancy, I got healthier, so it was very helpful. But my son's father had to work very full time and overtime hours. So like my support system was strong. Financials. I was lucky enough to be able to stay home, and I had my mom with me. My mom she babied me, so
Yeah.
thank God. She babied me before I had my baby. So if I didn't. I would say if I didn't have my mom and my fiance, I don't know how I would have done my pregnancy, because I like to downplay a lot of things. Like, I could be going through the worst thing in the world, having the worst crises, and I'm like, I'm fine, I'm chilling, it's a
Yeah.
cool day. So I'm sorry.
No, you probably. I see that you handle pain really. Like, it sounds crazy, and I don't like saying that to a lot of warriors, because, like I said, you guys hear that often. I can tell by listening to you, you handle pain really differently. So now I'm going to ask you, because I asked a lot of warriors this: how do you cope with your mental? Because obviously we talked. I have a son, and mentally it's hard.
It
It's
is.
super hard. And this is where we talk about resources, because it needs to be an outlet for you guys to have a open, like a open, thank you, a open like way to express yourself. Mentally, you're trapped. So how does it work for you mentally? Take your time. You don't gotta rush. You don't have to nothing.
I would say like my I loved being pregnant and everything, and it was a very hard battle for me to go through. But it was it was hard. It's very hard when you have to you put up a front your whole life, because you don't get taken seriously when it comes to being hospitalized for sickle cell. Half of the time, people automatically think you're supposed to be stronger because you can handle that amount of pain. And I'm like, a person shouldn't be feeling the amount of pain that people with sickle cell have to go through. And then on top of it, I'm sorry.
No, don't worry about it. I told you transparency. Take your time. This is what I love, because a lot of people don't understand. I do get it, because like I expressed to you, I'm always in and out the hospital with my son. So I agree with you. Even on a previous podcast, like I said, I interviewed my son, and he said it himself, it's hard. Mentally, everyone I've interviewed on this podcast have also expressed it's hard mentally. Because you have to be, if you're a mom or a parent in general, you have to be strong across the board. You can't seem down. You don't want to seem down, because when you seem down, your kid sees you like that. So it kind of affects you more. So trust me, mental, that's more so what I kind of want to go for, advocate for, because mental awareness needs to be really heavy within the sickle cell community as well, because it's a constant battle. What do you feel like, as in a sickle cell community, we could do together to make more awareness for mental health, and as in resources on that end?
That's for me, I think like what you guys are doing here, allowing people with sickle cell to share their stories. I believe there should be more like known support groups. I know there's support groups out there for sickle cell where you have people supporting you, and getting to see people who go through the same things that you go through. I feel like sickle cell, like, people know about sickle cell, but it's not it doesn't have a lot of people don't advocate for sickle cell like it should be. Like, people don't know about what the things people with sickle cell go through. They just know it's a blood disease and this and that. But so like, for an example, I would say when I moved down here last year of October, and I started going to the Sickle Cell Foundation because my doctor, Dr. Blyden, that I see, I saw him years ago when I was a high schooler, and he was one of the amazing doctors. He's a great
Shout
doctor.
out to Dr. Blyden.
Yes, shout out to him. Like, when you have sickle cell like me, it's hard to find really good doctors that actually sit and listen to you.
It is very true.
And understand your situation. So I feel like in terms of mental health and helping the community, there should be a lot more support groups and being able to bring people together, because it's a great feeling when you can see people like you, like coming, you. Like living in places like Tallahassee and Orlando. I don't see a lot of people like me that have sickle cell unless I'm going to the hospital, or people are not, as you said earlier, people are not walking around easy to find with sickle cell because we put on this mask because we just want to feel normal. Let people see we're normal people. Just because we're sick doesn't mean we're not up to the par of being human, of being regular, enjoying ourselves, and not having to worry about, oh, maybe I might go into crisis, maybe I might be sick. So it's just, support means a lot more than people realize. It does. Like that already gives me a great mental health boost. I would say personally, I ignore my mental health a lot. I try to tell myself, even when I'm going through the hardest thing, I'm not depressed. I'm the happiest person there is. What do you mean?
You try to suppress it.
Exactly. I try to hide it, push it away. But we need to be able to have support, to be confronted more, to be asked about what are we going through, actually have someone listening and understanding, and not just doing it because they pity your situation. Like, a lot of what I've gone through in my life is having to describe my diagnosis, explaining what sickle cell is, and I'm like, why do I have to repeatedly explain what it is?
To even say these things, so I totally get it. I get it. I like I said, as a mother, because the way you talk about your mom, I'm like that with my baby. I speak up for him. I don't want him to get hurt. I don't want nothing. I cause a ruckus, I'm not gonna lie, but for the right reason. A lot of warriors I have talked to, we talk about hospital visits. Do you have a hospital visit that was, I know it's gonna come to you, that was really just like, man, they don't understand me. These doctors don't understand me. Because as a parent, I have been there firsthand to witness doctors, nurses say some crazy, absurd stuff. And I've been like, are you serious? But in another math, you know, as a mother, I try, like you said, I try to keep that front in the positive aspect for him, so then that way he doesn't have that. So what was your experiences like? Give me at least one experience in the hospital that you have had that just is so memorable.
So, personally, I would say I have quite a few. But the one that really, really took the cake for me was, Jesus. Okay, I'm gonna do this. Okay. Last summer, I had moved to Orlando. I was living in Orlando for 2 years. That's when I first moved to Orlando, I found out I was having my son. So last summer, I moved, and I was in a different part of town. I ended up getting, I started feeling like really bad pain in my chest for a couple of days, and I like to, push things to make sure, like, if I don't have to go to the hospital.
Try to wait last minute.
I don't have to, because it's not a pleasant experience to have to be going to the hospital half of the time when they look at you like nothing's wrong with you anyways. And so I went to the hospital, and I repeatedly was telling them, like, I'm feeling pain in my chest. I feel like I may have pneumonia or maybe acute chest syndrome. Having sickle cell, those are like common things to develop when you have pain in your chest. So like, and then one thing I always say is, people with sickle cell, you know your body from the inside out. You know when you're sick. You know when you're about to have a crisis. You know when it's more serious than you're trying to lead it on to be. So they admitted me. And then the next thing about having sickle cell and going to the emergency room, like, you can go in with your cracking your knee. The first thing they're going to say is, try to diagnose it as, oh, you're having a sickle cell crisis.
Yeah.
Oh, there's something wrong with your sickle cell.
Agreed.
Sickle cell, sickle cell, sickle cell. And I'm like, it's not that.
Yeah.
And I repeat, and then so they admitted me under the impression of having a sickle cell crisis. And I told them, I was like, and then the next thing about being in the hospital is when it comes to being prescribed the proper medications for your regimen, because you know what to take and what you're supposed to be diagnosed, so you can get home faster, so you can heal better. And they never put you on the right thing. So
I understand.
the first couple days, no matter, I kept telling the doctor, I was like, can you please x-ray my chest? I know I might have pneumonia. The pain I'm feeling, I shouldn't be feeling this pain.
Yeah.
The doctors, I had 3 doctors back to back. No matter how much times I kept telling them, I need a transfusion, I need an x-ray, I have pneumonia, I need to be treated with antibiotics. Nobody would believe me. Nobody would listen. They said, no, you're having a crisis. We're treating you for a crisis. That's it, right? And the amount of pain that I was in, to have your chest inflamed in that much pain, and then your joints are going to start flaring because your body basically is in shutdown mode. And when, on top of not being properly treated right, it's like, you're in fight or flight mode in your own body, and you're having this war. And then so when it got the third day, third or fourth day, I got a doctor, this lady doctor. She came in, and then I told her, I said, I'm having crazy, I could barely breathe. The amount of pain I was in, and she could hear that I could barely breathe. I told her, can you please do an x-ray for me? I'm in so much pain. I cannot breathe. I know I have pneumonia because I shouldn't be in this much pain. This lady looked me dead in my face and told me, there's nothing wrong with you. I'm going to discharge you to go home today. And I'm like, what do you mean you're going to discharge me to go home? I said, I can barely walk from here to the bathroom without feeling like I'm going to pass out or breathe properly. And you're telling me you're going to discharge me today. And she lowered my medicine, because she was trying to discharge me. So I didn't have proper medicine and excruciating pain. I kept calling the nurse, crying to the nurse, telling her, like, yo, someone needs to help me. Someone needs to, understand and realize that I'm in excruciating pain. And then she's like, okay, I'm going to speak to the doctor. This is and that, An hour later, I felt like my chest was going to collapse. I couldn't walk to the door, so I was crawling to the door just to get the nurse.
That's so sad.
Because I couldn't breathe. I really couldn't breathe. And she had told me she was going to talk to the doctor, and she went out there to speak to the nursing supervisor because she's like, the patient clearly needs help, and she's,
if you're crawling, you need help.
She's in so much pain. That's what she was telling her. And I overheard her telling the other doctor that she told her I was in excruciating pain, and I was crawling on the floor because I couldn't walk. And to hear that a doctor was laughing at you being in that excruciating pain, not believing you, and it's just, the way I'm talking is like I'm downplaying it because I can't.
I'm a mother, and I understand exactly what you're saying, because when you see my son is, like I said, my son's 11, and when he gets in pain, I can't see him crawl. There you go. I can't see. I don't want to see him crawl on the floor. So never much less, you are a grown woman. You know what I'm saying? And we always have this. Everybody I've interviewed with this podcast as well. We also talk about the difference between pediatrics and when you cross over to adults. And it's funny that we have these conversations because I don't think it's like a mental preparation for it in a sense, because y'all hear about it, you know what I'm saying? Like, I look at my son right now, he hears about it. Like, he's preparing himself, and that's sad to me, because as a kid, you shouldn't have to prepare yourself for a future doctor that is not going to be attentive to your needs. But because you're a kid, they're more attentive. It needs to be across the board. So that's that just broke my heart. I'm not gonna lie. So did they end up discharging you?
Oh, okay. So sorry, I got myself.
No, it's okay, girl. You got me worked up too. I like it.
So after hearing the nurse telling the other nurse that the doctor was basically laughing and still not believing me, I told she called the nurse manager, called someone else above her to get me, because I was like, I need a new physician. You're not gonna cause me to die in the hospital. I literally I told my mom, I said, Mommy, I just want to talk to you because I don't know if I'm going to be able to leave this hospital alive, because they really don't believe me. And then, so I got a new doctor. The man didn't even come in the room for 2 minutes to see me. It took 1 minute for him to say, she needs an x-ray. She has full-blown anemia.
Yeah.
Full-blown pneumonia on her chest. She needs antibiotics. She needs proper pain management. Not even 2 minutes of the man listening to me talk, hearing how I'm breathing, seeing that I could barely walk, and he knew that I had full-blown pneumonia, like I've been telling the doctor for 4 days.
Yeah.
4 days. And then, like,
so that probably made you never want to go back to a hospital again, never want to.
I'm terrified.
Yeah, I would be too. I don't have sickle cell. I just have the trait. So I'm just, as a normal human, if I was treated like that, I would be livid. So I can agree that wouldn't make me feel like I'm in a safe space to go back to have somebody take care of my life and at least fend for me.
And the craziest part about it is that I didn't even care about the pain, and I didn't care about the crises I was going through. It hurt so much to have to feel like I was never going to see my mom and my son again. All because they don't
understand your full.
They don't understand. Or there's like this big stigma on sickle cell patients in the hospital. They just always look at you like you're drug seeking and you're just here just trying to get medication from the hospital. And I'm like, there's people who are really here to get help because we can't treat ourselves at home in this much pain.
Yeah.
After 4 days of being at home, trying so hard not to go to the hospital, and then I had to go to the hospital, and then to have to go through that, hearing that the doctor, she could even take 5 minutes of her day to order an x-ray to realize that I was telling the truth after 3 days.
Yeah.
And then to be told your hemoglobin is at a 5.
And they didn't blood transfuse you.
And I said, Jesus Christ. At this point in time, I'm my own doctor.
Honestly, a lot of sickle cell warriors end up becoming their own doctors.
My own doctor.
I can't tell you how many times I've heard a lot of people come, they tell me remedies, and I'm like, really? So,
because you have to learn how to treat yourself and know what you need to get better.
Yeah.
And then so it's just like, after that whole situation happened, I was like, you will never see me allow myself to be vulnerable around a doctor again or in the hospital. So like after that, when I would go to the hospital, I would stay at home. I would do my crying and my screaming and everything at home. And I would go into the hospital, put on my mask and then try to tell them.
Yeah.
And describe the pain that I know I'm in crises. I know this. And then, they're not going to believe you because you're not crying and screaming. 1 second you're crying and screaming and they tell you, oh, calm down. You need to relax. How am I going to relax when it feels like my arm is falling off?
Or when it feels like your whole body, like from what my son describes it, he describes it as like, it's like glass, like shatters, he's like, it's just it rushes through your body. And I'm like, somebody else described the pain to me as if like being ran over by like a construction truck and just going back and forth. So agree. How can you talk? How can you express what you are actually feeling or like you said, tell somebody, I need this. You can barely breathe. And I agree. It normally shows on every bit of every warrior's face when they don't feel good. And that is...
No matter how much you try to hide it, it's still
Yeah. So how does... I know you said that your son is young. How does he manage? Does he understand what mommy goes through?
So he's only 2 right now. So he doesn't really, I don't know. I think he
kind of gets it.
He kind of understands, because seeing that mommy disappears for a couple of days at a time and he has to stay with my sister or his grandmother, he understands a little bit. And I try not to make my son see when I'm in crises, because kids are like mirrors. Mm-hmm. Whatever they see off of you, they're going to they're gonna act it out or try to be it in some type of way because they look up to you. And so I just try my best not to make sure he sees me in that.
Do you wish that like within the hospital, within your stays, because I kind of have that battle too. I'm with my son. Mm-hmm. I have a daughter, so I can't have both of them in the hospital. Especially when it was like COVID time, I couldn't have both of them in the hospital. Do you wish there was like some type of support and some like maybe like a resource for parents that have, like I said, like kids like you and me and myself, where you can't like I agree with you, because don't nobody want to get seen like that, but it's hard to leave your kid for consecutive days like that
and not see them.
Exactly. So do you wish there was like some type of resource for that, some type of maybe if they created some type of outlet at the hospital at least for like kids to just come even when their parents are sick, or vice versa, like even with kids their family can come, they can stay the night, because I agree the support is very
very lacking.
It is.
I do think that hospitals should have a little bit more of a better visiting situation when it comes to people like with sickle cell that have young children that have to be away from them for long periods of time. It's just like with the visit. Okay, so in my situation, like there's times where I have to be away from my son 4 to 5 days at a time. If the hospital was more, I don't know. I really can't say if the hospital should be. I don't know. I'm in between about it, because the hospital is also a crazy area to have young kids in with their low immune system. Mm-hmm. So there's a part of me that's like, I'm okay with kids not being in that setting, because I don't want them to be sick or having to see their parents in that vulnerable kind of state. But at the same time, kids have the understanding. They're not slow to knowing that their parents are battling stuff, because they see it all the time. So maybe if the visiting situation allowed kids to come for a couple hours at a time and scheduled activities where they could do with their parents, instead of having them come and see their parents sitting in a hospital room, sitting in a bed all day, like maybe like programs like that.
Yeah, it would be more resourceful. It's more uplifting.
Yeah,
and it helps. It helps and get your mental. I always say that it helps with your mental, your spiritual, and your physical. Because mentally, like I said, you trapped in 4 walls all day, and that's not okay. And then spiritually, you're feeling decline because your body is down, and emotionally, it's just nothing there. So I get it.
Like maybe they could do like a family. You know how like when you go to asylums or mental clinics, they have family day.
Yeah,
maybe
like
they could have like
day.
Family hours throughout the week, and they schedule certain activities each day to have because I feel like it'd be patients heal better when they feel like they have a support system and have their family around them. And then so if you could go do this activity with your family, like let's say you have younger kids, let's paint together, let's do a movie hour or something where families can come and watch movies.
Welcome, FSCDR Warriors Within, and we're back. I'm with Renee. I'm Coco. Loving it. I'm loving it. I'm loving our conversation. I want to dive into your origin.
Okay.
We talked about your Jamaican descent.
Mm-hmm.
Jamaican American. Let's say it, because
Jamaican.
yeah, Jamaican. I know what that's all about.
Yeah.
How elaborate how your parents took care of you with a Jamaican descent, because I'm familiar with the Jamaican culture. I'm very aware that Jamaica is aware that they have sickle cell anemia, but not everybody handles it the same. And in the Caribbean culture, you guys are taught to herbalize and medicate yourself naturally. How did your parents help you grow up and like nurture you to know like you said, know what you know now?
Yeah. So I would say being Jamaican and having sickle cell, a lot of the a lot of the ways we do treatment for sickle cell is, as you said, herbalizing. So it's drinking tea, making sure like you do know SS tonic. It's like a bitters. Oh Lord
It's
God,
nasty.
it is disgusting. But yeah, so you just try to heal through food. Make sure that you're well fed, you're hydrated, you're getting the proper whether it's iron from callaloo, beet juice to increase your hemoglobin. It really helps. So but it's nasty. I hate beet juice with a passion.
No, I know what you mean. It's
so
not
yeah,
good.
like growing up, that's a lot of the ways that.
Did you notice that did you see like, because my son looks at me and he sees certain trials and tribulations that I go through. Now that you're a mom, do you look back and see what your mom like went through when what do you remember, as in like her being in hospitals with you, helping you, telling you, because as a parent, you try to teach your kid, this is what you're going through. You need to know these things, because when you grow up, this is how it's going to be. So what did your mom instill in you to make sure that you carried throughout life?
So I would say, okay, so I was raised by my stepmother. When I moved here from Jamaica, I came with my father, my stepmom, and so my mom stayed in Jamaica. As a kid, my mom, it's like you don't really realize what your parents go through or have to go through having sickle cell as a kid. So my mom had to deal with that since I was a baby, having to be at the hospital for long hours and being terrified, not knowing whether I was going to be okay having a crisis, because who wants to see their baby
Nobody wants
through
to see a baby
that?
like that.
Like, I know it's not easy for you to see your son in that position. So, like, what I would say mostly what my stepmom and my mom instilled in me is just making sure that even though I may not like having to, just be careful, like take that extra step of making sure that I'm eating properly, taking my vitamins, not overworking myself, getting sleep, that kind of stuff. But I'm stubborn, so
as a kid, most of the time you don't want to hear what your mom has to say, because you want to be a kid.
Exactly. As a kid, it's like the only thing that I really didn't like about, like, I didn't really understand about being sick is like things like my sister doesn't have sickle cell, like things my sister was able to do with my cousin, like they could go to the pool, all like, and whether it was cold or hot, I didn't understand why I had to sit on the side and not be able to go in the water. Like when we would go on field trips, like I would have to sit out while people went on the rides, and I'm like, I never understood why I would have to be missing out on certain activities. I'm like, I don't want to hang out with adults. You guys are adults. I'm kids. All the kids are over there having fun. But it's just like being an adult now and seeing like all the stuff that I have to go through during my crises. I'm like, it could have never been easy on my mom to see that happen to me. Like when crisis strikes 5 o'clock in the morning. Who wants to get up at 5 o'clock in the morning and go to the ER? Like, not even I want to do that half the time, but I'm like, no matter what I was doing, she did that. She got up. She advocated for me. She made sure I was okay. She made sure they treated her baby in the best ways that they possibly had to. So at me now being a mom, what I take from that is no matter how tired or how aggravating things may get, you still put your first foot forward, and you always make sure you look out for your baby, and your baby is always going to be your top priority. So
So
I don't
my
know.
biggest question I want to ask you, what do you hope for as in a change? Because we do have new medicines coming out, new therapies, gene therapies to participate in and stuff like that. Where do you see a big change, a positive change in sickle cell in the near future?
So, what I see as a positive change is, as you said, there's a lot of treatments out. Like you hear about the gene therapy that's being tested right now, where they can completely correct your gene from having sickle cell at all, and hopefully, it's like a cure to you. Or there's the other one where you can do the bone marrow. I've always been interested in doing the bone marrow transplant, but at the same time, I'm like,
You're scared.
yeah, I'm scared. Like
The process is
it
really
is a hefty process.
It is.
And then also you having to find someone that is a direct match for you for the process. My thing about it is like I want in the future that I'm hopeful that these trials work for more people.
Yeah.
So kids that are being born with sickle cell don't feel like they have a time stamp on their life because they have sickle cell. They see the hope that there are actually cures. There's actually treatments that are decreasing you having crises. It's like I just want it to actually feel like there's hope when it comes to change and living a regular life and not feeling like you're walking around with a sticky note on your forehead saying I'm a sickler.
Yeah.
I don't know. I just want kids to feel normal.
I truly believe because like I said, I'm a big advocate for it, and I truly believe in our future further down the line. Because the way we progress in the future is fast. I do believe that it will be a big turnaround for sickle cell anemia, as in for awareness wise, support wise, and just all across the board. Because I agree with you on everything. I'm gonna kind of wrap this up though, but to touch on something before we to backtrack. Just know that you are loved. You have an abundance of support. You are beautiful inside and out,
Thank you.
and you are beyond the strongest warrior thus far I have seen on this, and I have interviewed. Yet to make me cry too, but I appreciate you coming and expressing, giving me full transparency because it's hard to really express and really tell people, hey, I go through this because they look at you with a side eye or they don't really understand or it's just like, oh, I'm sorry, like, get better. And it's not that. And you have so much to fulfill on this earth with your positivity and your awareness, and I can just see the energy brewing through you. So I appreciate you coming on this podcast and expressing and showing everybody like the real deal and the real authenticness of what it's like to be a mom, a young mom, a Jamaican mom. You know what I'm saying? I really appreciate you coming, Renee, and I hope I see you again.
Thank you, Coco. I really appreciate you having me today. This really was a fun experience. At first, I was nervous about it.
I told you it was gonna be fun.
Yeah,
I told you it was gonna be fun.
I told we was gonna vibe. We vibe. We definitely did. I didn't mean for it to get so emotional. I just didn't really think actually hearing out loud the things that I go through really would affect me that much.
You are not the only one. You are not the only one. All you warriors are the strongest. Like I said, I know you don't like hearing it, but people like me, as a mom, we appreciate it because I'm pretty sure your mom probably never told you were her strength to push as hard as she needed to get you the care that she needed. So just off of your strength alone, watching you like that, you encouraged her and you motivated her to be an advocate and push for you and watch out for you as much as she could. Because your mom, like I said, your mom sounds like me. And listen, and I'm all for it. We got to stand for every sickle cell warrior from baby to adult-wise. And I do believe we will have an abundance of resources and opportunities to make more awareness and more attentiveness to sickle cell. But
I really hope
thank
so.
you so much, and thank you for joining me.